Welcome one and all. I am Ms.K.Kanimozhi, lecturer, Department of Hospital Administration in Sita Lakshmi Ramasamy College. Today's session we are going to see about the disease of stroke. A stroke occurs when a blood vessels in the brain that ruptures and bleeds, or when there is a blockage in the blood supply to the brain. It means when there is a blood blockage in the vein that affect the disease of strokes. The stroke is a temporary loss of consciousness. This image shows that an interior blood flow blockage. This is the causes of stroke. When there is a blood flow is affected in the interior vein that causes a stroke. Classifications of stroke. There are three primary types of strokes. Namely, first one is a transient ischemic attack, TIE. Second one is ischemic stroke. Third one is hemorrhage stroke. Isomic stroke. Isomic stroke is the one type of the stroke. It involves a blockage in the vein that can be caused by either a clot of blood or a block in the artery. The symptoms and the complication of ischemic stroke that can be lost a longer duration or maybe due to the permanent disease. Signs and symptoms of ischemic stroke. First one is embolism. Embolism means a blood clot. Next one is thrombosis and venous thrombosis. The third one is weakness in both the arms, face and leg, especially on one side of the body. Next one is troubles for speaking or understanding others. Next one is confusion, disorientation or lack of responsiveness. The next one is sudden behavioral changes, especially increased agitations. Next one is vision problems. Vision problem is due to the vein blood clot. Hemorrhage stroke. Hemorrhage stroke is one of the type of stroke. It is caused by either a burst or a leaking or leakage of blood vessels that seep into the brain. A hemorrhage stroke happens when an artery in the brain breaks open or leaks of blood outside of the brain. The blood from the artery creates a excess pressure in the skull and swells the brain, the damaging brain cells and tissues. Signs and symptoms of hemorrhage stroke. First one is weakness in the arm, face or leg. Second one is sudden confusion. Third one is speaking difficulty. Fourth one is dizziness. Fifth one is a loss of balance in our body. Then sixth one is sudden and severe headache. Next one is a difficulty in seeing one or both the eyes. Treatment of hemorrhage stroke. First one is support the head and shoulders on the pillow. Second one is loosen the tight clothing. Next one is wipe away from secretion from their mouth. Maintain a body in a normal temperatures. Next one is ensure the airway in clear and open. Some of the medicines are taken for this treatment. First one is IV medicine. Second one is angioplastic. Third one is stent attachment. Fourth one is removal of blockage. Fifth one is using the aspirin drugs. And sixth one is intravenous thrombolytic therapy. The most common treatment is the angioplastic and stent attachment. Thank you one and all.